So what we're doing now is we're back in the same mold. We've already brought the tissues together, and see how fine that closure is. But now we're gonna follow that up with a superficial closure. And what we're doing here is we're gonna do the closure from underneath instead of outside. So that even leads to a better result. And this is how we do it. We come from the sides and then go into the incision there. And we're gonna just continue snaking that a little bit back and forth to affect the closure. And I try not to grab the skin edge. I just use my pincer to essentially grab the skin. And I'm going to keep doing this back and forth, you see. This is a really nice way to close the skin without leaving too much pressure on the skin closure on the outside, so it, so hopefully we can make it heal so it has as minimal skin residual as external skin residual as much as possible. See how we're just under the skin? I'm going to keep doing this until we're totally closed the area. And we're going to keep going. And we're going to continue that until it's all the way closed, and then we're going to finish off excising more moles, and then we're going to do some lasering of the smaller moles. And that's going to be another video. Thank you.